Good afternoon. Index patient is a 23 years old single Hindu male, educated till MCA final year, belonging to lower socio-economic status, resident of rural area of Turkey, Haridwar, Uttarakhand. Patient was admitted to the hospital on 18th of March 2022. A history was given by the patient himself and his father, named Ashok Kumar, 55 years old male. Father is in contact with patient and is staying with the patient since last 2 years. History is adequate and reliable. Complaints are being predisposed by one previous episode 1 year back, perpetuated by by non-compliance to medications and precipitated by increased use of cannabis since last 1 month. Complaints are acute in onset, continuous in nature, and deteriorating, with complaints of cannabis intake in form of sulfa since last 5 years, increased since last 1 month. Complaints of over-talkativeness, tall claims, irritable behavior, suspiciousness, and decreased need for sleep since last 20 days. Patient was apparently well 5 years back when he joined his college. He pursued MCA and started taking sulfa along with his college friends. He began taking it in college hostels at first due to curiosity, and also his friends persuaded him to take it. At first, he took only 1 joint. He liked the effect and felt light and relaxed after smoking it. 1 day after, he again took it at night itself with the same group of friends in hostel. This time, he took 2 joints. And since then, he used to meet his friends daily and used to smoke sulfa along with them. Now, during a span of 3 to 4 months, patient started taking 5 to 6 joints of sulfa daily, as he was not able to achieve the same pleasure as earlier. He increased the intake gradually. If sometimes he would skip taking it, he would get a craving for it, and then he used to take it again. But due to his sulfa intake, he was not able to concentrate on his studies. Although being a good student before, now his grades started deteriorating. This led him to increase his joints, and within a period of 1 year, he started taking almost 7 to 8 joints per day. 2 years back, as the corona lockdown took place, patient had to return home in duty. His parents would notice that he frequently used to lock himself in his room and spent more time in the bathroom. After checking, they found that he is taking sulfa. The whole family was frustrated at the sight of their son taking sulfa. His father tried to explain him to quit smoking sulfa, but he would become irritated and would not listen to them. Instead, he started going out and smoked outside. He would come home only to have meals and to sleep. Most of the time, he would stay in his room all alone. This was the time his intake increased to 1 joint almost every 1 to 2 hours, up to 12 to 13 joints per day. Then in year 2021, his family members noticed that he has started to be more quiet and would seldom interact with his family members. He even stopped taking meals with his family and preferred to stay alone in his room. He stopped going out with his friends. Whenever family member used to ask him why he is so quiet, he would become verbally abusive towards his family members. He would be suspicious. Against family members and said that they are people who are planning against him and somebody wants to harm him. He would be scared and used to lock himself inside the room. He even started complaining and being suspicious of his mother that she is having some extramarital affair with other person in the neighborhood. He would become very restless and would keep on pacing to and fro within his room. He would even sleep late at night until 3 to 4 a.m. at night. He would stop attending his online. He would also stop attending his online classes and often skipped meals. Within a month, his family members brought him to the respective hospital. Patient was admitted and he was started on treatment. He was the symptoms subsided and the treatment was continued till about 3 months, after which the patient stopped treatment on his own without consultation. This time, the patient remained absent from cannabis, from sulfa at around till around 8 months. After which, I again started smoking sulfa with his new friends. This year, around 20 days back, patient at around Shivratri started taking sulfa in increase, and he started taking increased quantity of sulfa at around 1 joint every hour. His family members noticed that his family members noted that he has started talking much more than usual, and it became difficult to interrupt him while talking. And if someone tried to interrupt him, he would become really irritable, and due to anger, he would verbally abuse and even physically assault his family members. He also said that he wanted to buy a 1.5 lakh bike and persuaded his family members to sell the old bike in order to buy the new one. He also said that he wants to go abroad and to start a business there. He also had plans of joining politics. He also started being suspicious of his father, that they are trying to mix something in his food and also in his cigarettes. He said that the recent Havan conducted at home was against him to stop him from taking joints. Patient is very irritable towards his father and is verbally and physically abusive towards him. Patient became very restless and used to keep on pacing throughout the home, and he also used to sleep only 1 to 2 hours per day. Even after sleeping so less, patient used to be fully energetic the next day. Patient also started overeating, and now and he was a vegetarian earlier, but now he was taking eggs, 2 to 3 eggs per day. And he also there was increase in appetite, and he started taking 4 to 5 chapatis per meal. In lieu of all these complaints, patient was brought to the respective hospital. In negative history, there is no history of hearing of voices not heard by others. There is no history of people talking or discussing about the patient among themselves. There is no history of repeated thoughts or ruminations or repeated hand washing. There is no history of any vaccine flexibility, mutism, stupor. There is no history of any significant head injury, loss of consciousness, any history of ENT bleed, or there is no history of any abnormal body movements. In treatment history, 1 year back, he was given lithium 600 mg per day along with olanzapine 7.5 mg, tablet trihexyphenidyl 2 mg, tablet clonazepam 1 mg divided doses, and tablet propranolol 40 mg divided doses. This treatment was continued for around 3 months, after which the patient left treatment on their own. In past history, last year in 2021, in the month of February, there were complaints of irritable behavior, restlessness, decreased social interaction, suspiciousness, and decreased sleep for 3 months. In family history, yes. So this past episode is the same episode in which no, sir. Yes, sir. That was previous episode. Sir, 1 year back. So 5, because we started taking cannabis 5 years back. I explained sir 5 from 5 साल पहले. So 5 साल पहले से history president ने start किया मैंने from taking cannabis. Yes, sir. Then current episode started when? Sir, 20 days back. So why have you included all those episodes Because it was related to cannabis.
It was related to cannabis, but we यार बाइपोलर डिसऑर्डर में सारे एपिसोड बाइपोलर से रिलेटेड है सारे एपिसोड प्रेजेंटेशन डाले आपने अपने आगे प्रेजेंटेशन तो सारे एपिसोड कवर कर लिए then we get almost 8 months experience from them as well as division in terms of symptoms वो सारा आपने डिस्कस कर लिया तो आर्ट में उसको ठीक है पर अभी सेम तो आपने पास में मेंशन कर दिया आगे कुछ कंट्रीज इन व्हिच डिपेंड द बेसलाइन okay then it is not a pass then the mention again pass so the same episode is going to doesn't mean that take almost 70% of the also the same episode is mentioned in past tense so first we decide which is the what is the correct episode अभी क्यों आया है वो हमारे पास बताओ अभी क्यों आया है
So because of over talkativeness, toy claims. Yes, sir.
but from when this episode started as per you
So 20 days, since last
उससे
20
पहले
days.
कैसा था
So he was taking cannabis, but the frequency of cannabis intake increased since last 20 days.
what is this is last days
So frequency of taking cannabis.
but was he maintaining his functioning his social functioning
Yes, sir.
and you were off
Yes, sir. No, it's not on treatment.
what do you think is this a continuous illness or from last 5 years it is a kind of episodic illness
So episodic illness.
so why that illness episodic illness तुमने अपने जो करंट इस 20 days का 20 days कितने दिया 20 days की हिस्ट्री में मैं सर्वाइव है और 30 days में पास है थोड़ा स्पेशल मेडिकल देखिए पूरा था सस्पिशियस पूरा था तो अभी करंट सस्पिशियस बताओ करंटली बताओ you are mentioning that patient is energetic even without sleeping but kind of energetic उन्होंने ये बोला तो बट he is very energetic but you have mentioned current episode in the form which is follow समझाया क्या हो रहा है you also mentioned that he was say physically and mentally ill did the family member the informant on the patient itself that I was physically and mentally ill they must ask what kind of popular use what kind of physical abuse showed them mention that it was present in this but this is all the present is all the time from the past even though the cannabis use might have been continuous, but if we attain kind of behavioral control and functioning control, so that actually will pass and that's what is also pass right? So I explain everything you can. So अभी तक हमने क्या किया है तो कितना है और also in addition starts as symptoms.
Yes, sir.
Pass definitely to explain everything.
But
since last 5 years, if it is very continuously for a kind of अगर estimate is correct, we cannot think of it. But still, since symptoms currently started 20 days there, stay 20 days.
but जैसे हम complaints में लिखते हैं कि cannabis intake in the form of sulfa since last 5 years. Yes, sir. सर अगर सर बीच में अगर 8 months तक उसने नहीं लिया था तो सर हम ऐसे लिखेंगे since last 3 months cannabis intake. So in the complaints we are writing cannabis intake since last 5 years. But बीच में सर 8 months के लिए abstinent थे. तो सर 3 months से लिखेंगे.
8 months abstinent थे तो 3 months
सब
कोई 10 साल पहले पीना था अल्कोहल का डिपेंडेंस 10 साल से रखा और अपना वर्क मेंटेन कर रहा था अभी एक मिनट शुरू कर दिया तो आपको 12 साल की शुरू
बट सर एब्सेंट एटलीस्ट 1 ईयर की होनी चाहिए तब तो
अगर ऐसा मेंशन है तो आई डोंट रिमेंबर अगर ऐसा मेंशन है तो देन यू कैन स्टिल कंटिन्यू कैनाबिस इज टेक फ्रॉम लास्ट 5 इयर्स अभी दिस इज टेक अगर तुमने क्लियरली मेंशन है 1 ईयर सेंटेंस में हम मान लेते हैं डेफिनेटली
सर आई थिंक आई
but definitely अगर I think that's okay I am saying क्या करना है take 5 years कर सकते हो ठीक है अगर but और but ये जो तुम्हारे इससे लगता है तो एक बार ट्रीटमेंट लेंगे ठीक होगा तो वो सब चीजें बता के बताने मैं को and not necessarily this episode might be similar to this episode
yes
तो वो तो हमें जज करना है ओके तो तुम तो अभी करंट बताओ करंट currently वो अभी आए हैं हमसे हेल्प में, अभी उनको प्रॉब्लम नहीं है, तो अभी हमें समझना है कि ये एपिसोड क्या है, तो देखते हैं पास्ट में बताएंगे पास्ट में, you cannot mention the same episode in present same past, present और past में डिफरेंट होगा ना, ठीक है, सेम एपिसोड को पास्ट प्रेजेंट में मेंशन कर सकते हो, ठीक है, उसी में जो ट्रीटमेंट सिस्टम में बताया पास्ट एपिसोड की दैट इज ओके, पहले ट्रीटमेंट दिया जो मेरी मेल सिस्टम दिया जो भी दिया बंद हो गया ट्रीटमेंट और कॉज मेंटेनिंग डिस्ट्रिक्टली वेल फ्रॉम लास्ट 8 मंथ्स some return to of the vaccine rate social functioning then third episode is from 3 months अगर मतलब हम इस तरह से जाएंगे तो बाइपोलर को तो कभी पास एपिसोड बना ही नहीं पाएंगे तो फिर वो एपिसोड की जरूरत नहीं बाइपोलर तो कंटीन्यूअस रिलेशन होगी तो हटा के सारे कांसेप्ट्स चेंज हो जाएंगे ठीक है currently this influence suffering from an episodic illness probably there are the reasons not we don't know वो हम सिम्टम से डिसाइड करेंगे but current episode from 20 days that's it तुम कैनाबिस इनटेक आई फील कि वो 1 ईयर वर्क क्रेडिट आई डोंट हैव बट इफ इट इज देयर देन यू कैन यूज कैनाबिस इनटेक फॉर 5 years continuous ठीक है विद पीरियड ऑफ एक्सीडेंट लॉन्गेस्ट पीरियड लास्टिंग फॉर 8 months okay
ठीक है
but I doubt that but even if you start with cannabis intake starting from 1 month and symptoms starting from 20 days and the past episode with 4 years of cannabis intake and symptoms lasting for 3 months in past that's okay or either you don't put that episode in your class but when it is तुमने past में डाला क्या प्रीवियस में ठीक हो गया
ठीक है
very clearly present होता है आपको एक बार नहीं हुआ दूसरी बार नहीं हुआ दूसरे फिल्म नहीं हुआ तो तीनों एपिसोड से नहीं अभी वाला डेट बताओ पहले वो दूसरा वाला डेट पास से दोनों तीनों का बस बातें वाला
information is your cannabis use. So about that, we can explain only the cannabis part. If it is confused, if it is not absent, patient is the cannabis dependence first, and then we can explain this episode. We can write.
If you want to mention after the cannabis intake from last 5 years continues with a history of vagal disturbance in February during which cannabis intake was there. But then तुमको cannabis history बता दो उसके बाद जब सेकंड शिफ्ट में ब्लड टेस्ट करके शुरू करें तो करंट यूरिन डिस्ट्रक्शन वो 20 डेज अगर आपको मेंशन करना तो ऐसे मेंशन कर सकते हो cannabis में 5 years intake increase period of abstinence an episode of vagal disturbance lasting for 3 months वो cannabis history में चला गया if you want to keep it continuous cannabis intake for 5 years that is okay ठीक है but अगर significant period of abstinence was there then cannabis also current and won't be actually disorder हो सकता है cannabis episode of USD if cannabis 5 years continuous that is not wrong but जो इसका previous episode है वो previous नहीं है okay आप पास mention कर सकते हो which vagal disturbance for 3 months वो cannabis की history मतलब cannabis की कंपेयर एक्सप्लेन कर रहे हैं लेकिन अभी तक जैसे आप उसको ऐसे एक्सप्लेन करो lot of things you were mentioning as a topic from ICD or DSM like right इससे ज्यादा कुछ करना हम लोग मैं तो ICD हम लोग को रेजिस्टेंस लगे तो सिम्टम आ रहा है मतलब एनर्जी इस क्या because not significant you must mention how much was it other than not significant he used to sleep at 1 a.m. and get up at 4 a.m. and still continue going out getting agitated or at all also maintain this work function that will make degree not what you are saying that you make degree what verbal abuse and also I got I when to explain to cannabis what do you think is simple that's why patient is simple then you have to ask what do you mean by simple but substance because each cannabis component is different and each has different amount of the psychoactive substance so what do you mean by simple and what do you mean by dry I don't understand what is simple अगर तुम joint और simple task तभी यूज कर सकते हो जब patient ने बोले हैं but then you have to ask what do you mean by simple simple क्या मतलब मैं simple ले रहा हूँ क्या लिखूं वो किसमें ले रहा था simple मतलब जिले में ले रहा था किसमें ले रहा था और मतलब कितना कंपोनेंट था उसने क्या मिक्स करा था बिल्कुल plain simple ले रहा था ग्लास में ले ग्लास ले रहा था या कैसे ले रहा था प्लेन ले रहा था उसमें टोबैको मिक्स कर रहा था but is this meaning also then we have to understand the almost cannabis amount कितना था can it lead to psychosis or not then only we will be able to make cannabis psychosis what do you mean by joint I don't know what's joint card joint सीट है, अगर मान लो यहाँ पे नॉर्मल साइकियाट्रिस्ट बैठा है तो उसको बैठ सकते हैं, जैसे बर्मा साहब बैठा है उसको बैठ सकते हैं, उसमें बताना होगा अगर पेशेंट के जॉइंट से पेशेंट का क्या मतलब है एंड बट बी इंटरप्रेट बाय हिज जॉइंट। हाँ that's what was right. You have to try to but you have to stay with this but is right as per him। तो वो कह रहा है जितने चार को ज्वाइन तो आप ज्वाइन यूज करोगे, लेकिन आपको बताना होगा उसको ज्वाइन उसके साथ ज्वाइन करके उसने एक सिगरेट में निकाला और उसने इतना ग्लास मिक्स किया, ठीक है, जैसे कार्बन बॉक्स अगर वही है तो उसको पूछना पड़ेगा क्या था काले कलर का या मांस कलर का, काले वाले में कैरेक्टर अमाउंट लगता है मांस वाले में कैरेक्टर का अमाउंट और उसमें वो टमाटो को ज्यादा नहीं करता। That is okay. You have to find out but you have to explain it here what does he mean by that? तब तो हमें समझ आएगा। आज तो यार सब कहते हैं मैं तो ब्रेक लेता हूँ, मतलब ब्रेक ले क्या ले रहा है हम उसने जब वाइट ले रहा है तो ये आई इंटरनेट पर लिख ले रहा है क्या लोकल ले रहा है लोकल लेके स्टार्ट यू नीड टू अंडरस्टैंड कि वो लोकल ले रहा है और क्या उसका कंपोजिशन है, यू मस्ट ट्राई टू अंडरस्टैंड एंड यू मस्ट लोकल नॉलेज आल्सो वाइट एक्सप्लेन करते हैं actually आप लोग वही करने को बस ट्राई अंडरस्टैंड।
So in family history, he has body interpersonal relations with all the family members. He is the youngest of the three siblings, and the emotional and the economic head of the family is the father. The family is supported towards the illness and understands the importance of follow-up. In birth history, it was a normal full-term vaginal delivery at home. There was no history of any antenatal, postnatal, or complications. All the developmental milestones were achieved as per age, and all the immunization was received as per schedule. There's no in the childhood history. There's no history of any hyperactivity, attention deficit, impulsivity, any history of lying, stealing, or truancy, and no history of any temper tantrums, encoparesis, or tics. In home atmosphere in childhood and adolescence, there's no history of any desertion by parent, broken home, step parent, or adopted sibling. In scholastic history, the patient was good in academic. He scored 98% in class 10 and 87% in class 12, after which he went to pursue MCA. In vocation history, he's never did any job till now. In sexual history, the patient received all the sexual information by internet and through his friends. The history of any relations were not able to be, was not able. There was no history of any forensic history was not reported. In pre-morbid personality, the patient is ambitious and he wants to pursue his business. In relation, he prefers company, and in work and leisure, the patient hobbies were to sing and to watch movies and surf on internet. His mood was stable and he was able to express feelings of love, anger, and frustration. In character, the patient was very ambitious and he used to pursue his hobbies, and also he used to like studies. In habits, the patient also is smoking cigarettes since last 9 years, and also alcohol occasionally in parties and with his friends. And also sleep-wake cycle is normal, bladder bile habits are normal, and he is a vegetarian. Implying the pre-morbid personality is well balanced. In general physical examination, the patient was well built, was average built. There's no history, there's no edema, there's no edema or koilonychia, no clubbing, swelling, and lymph nodes are palpable. In his BP was 110/70 per minute with pulse rate of 86 per minute. In cardiovascular examination, normal S1 and S2, normal heart sounds were heard in all area of precordium. And there was no murmur present in respiratory system. Chest was bilaterally symmetrical. Trachea was central. The bilateral vesicular breath sounds were heard, and there were no added sounds. In abdomen, there was no mental status examination. In mental status examination, he was a mesomorphic built male wearing a dark blue t-shirt and blue jeans with uncombed hair but trimmed beard. The patient appeared his stated age, entered the room unaided along with his father. His grooming and hygiene his grooming was not quite maintained, but hygiene was maintained. He was in touch with surroundings. Eye contact was established and sustained. Attitude, he was cooperative but irritable. Rapport was established. And psychomotor activity was increased. Speech, tone, intensity, volume was increased. Reaction time was decreased. His speech was relevant, coherent, and goal-directed. His attention was arousable, was sustained with difficulty. In orientation, time, he was oriented to time, place, and person, and also passage of time. In memory, the recent memory, remote memory, and the recent, remote, and immediate memory was intact. In abstract ability, the patient was able to mean idioms and also tell three similarities between apple and banana, and also three dissimilarities between apple and banana. And in the abstract ability, he was able to tell पेट में चूहे दौड़ते हैं. He said that भूख लगना. He said 9 to 11 हो जाना मतलब भाग जाना. He said अपस्ताई होत का जो चिड़िया चुपके थे मतलब अब जब काम हो गया तो अब क्या पछताना. And in general information was intact. He was able to tell this. He was able to tell the Prime Minister of India. Also, he was able to tell that what is the capital of India and the capital of Pakistan. In calculation, he was able to do simple verbal and written calculations. In intelligence, his intelligence was intact. In mood, he said bekar hai. Affect, irritable. The mood is full range, reactive, congruent, and communicable. Thought, stream of thought. Thought was the productivity of thought was stream was increased. There was prolixity of speech was present. There was no the form of thought was normal. The possession of thought was self. In content, he said that he wants to join politics and he wants to buy a very expensive bike of 1.5 lakh rupees, implying that his self-esteem is increased. There was no perceptual disturbances. In judgment, test was impaired. I asked him, what would you do if you find a letter on the road along with name and address? He said that I will check the letter if I could get some money from it. And if there is a chance of getting money, I would get it. And his personal and social judgment were also impaired. And inside, he completely denied his illness. So the inside is grade 1. So the patient was very irritable. Sometimes he's irritable. मैं आपको क्यों बताऊंगा? मैं ऐसे जा रहा हूँ तो. Yes. So the first differential of the cannabis mental behavior disorder. So patient 23 years old, single Hindu male, educated till MCA final year, belonging to lower socioeconomic status, resident of rural area of UP, Haridwar, Uttarakhand. Patient was admitted on 18th of March 2022. The history was given by the family member, his father, and patient himself. History is adequate and reliable. Predisposed by there was past history of one episode 1 year back with complaints of irritable behavior, restlessness, decreased social interaction, and suspiciousness and decreased sleep. The patient received treatment for 3 months, after which the patient left his treatment. The complaints are being perpetuated by cannabis intake in form of sulfa since last 5 years, and currently precipitated by increased intake of cannabis since last 1 month. The complaints are acute. And episodic and deteriorating in nature, with complaints of over talkativeness, tall claims, irritable behavior, suspiciousness, and decreased need for sleep since last 20 days. So positive mental status examination. He was a mesomorphic built male with uncombed hair. The grooming was not maintained, but hygiene was maintained. His attitude was cooperative, but patient was very irritable. The rapport was established with difficulty. In psychomotor activity, it was increased. Speech tone intensity volume was increased with decreased reaction time, and speech was relevant, core, and goal directed. Attention was arousable but sustained with difficulty. Orientation, it's oriented with time, place, and person, and the passage of time. Memory, recent, remote, and immediate were intact. Extractability was intact. So in mood was bekar hai. Affect was irritable. Range full, reactive, mood found again, and communicable. In thought stream, velocity of speech was present, and there was increased productivity of speech. Judgment, so before that, the content, increased self-esteem was present. And judgment tests, personal, social were impaired with sight of grade 1. The patient is kept on the first differential of mental and behavioral disorder due to cannabinoid dependence syndrome, withdrawal state complicated with induced psychotic disorder, predominantly mania, and second differential of bipolar affective disorder with current episode mania with psychotic symptoms. So, but it was increased as per normal, as supposed to normal. So, इतना नहीं था. Recently, he also said that अभी मुझे bike खरीदनी है, बहुत महंगी. और he said his father that he should sell the old bike and I want to buy a 1.5 lakh bike. Earlier, he never had such thing. Never he showed interest in politics, but recently, since that 20 days, he also saying that he wants to join politics. He wants to go abroad. But earlier, he didn't say such things. He was ambitious, but. So 11:50. So MCA. So he's doing MCA. So but family members की salary से ऐसे rural areas. तो father से भी छोटा सा.
आप 2 घंटे बाद करो। ये रोज सोशल कॉमर्स से तो नहीं आएगा, अगर मतलब मेरे को अकाउंट करना है तो नेक्स्ट स्किल में जो आप लोग ज्यादा यूज करते हो, लेकिन भी एजुकेशन एमकॉम है और मतलब तो उसमें मतलब पोस्ट ग्रेजुएशन होगी, तो पोस्ट ग्रेजुएशन में होते ही कैसे से वो रोज ऊपर हो जाएगा, है ना? मतलब
So no,
उसमें-
it is head of the family.
About the head of the family. Occupation of the head and occupation of the at the income of the head.
फर्स्ट मेंशन क्या था?
Cannabis. So mental and behavioral disorder due to use of cannabinoid dependence syndrome, withdrawal state,
मेंटल बिहेवियर डिसऑर्डर बिल्कुल
cannabinoid cannabinoid dependence syndrome.
आगे
So withdrawal state complicated with induced psychotic disorder, predominantly mania.
विड्रॉल को कैटेगरी तो अलग उसमें है और साइकोटिकली कैटेगरी अलग उसमें है, तो साइकोटिकली तो आएगी 0.5 और विड्रॉल वाली आएगी 0.2, isn't it? So complicated आएगी 0.21, तो what is your value? It is 12.2 और 12.5, दोनों दो आपने दोनों बोल दिए, तो आपका आंसर क्या है?
So with induced psychotic, so with
विड्रॉल और साइकोटिकल
so अलग-अलग है सर, but सर एक बार बोला था यहाँ.
So you have both 12.2 and 12.5.
So वैसे तो सर psychotic वाला ही होना चाहिए.
बोला है। ये इसमें भी वही तो है। अलग है।
तो अलग-अलग है but अलग है.
कुछ मन का है। Right? Withdrawal state dependence syndrome point में तो withdrawal आएगा with complicated होएगा 4 और psychotic 0.5 आएगा ना,
तो दोनों नहीं आ सकते सर.
दोनों तुम्हें अलग-अलग डायग्नोसिस बोलने पड़ेंगे। बोल सकते हो withdrawal भी हो सकता है और वो induced psychosis भी हो सकता है, आई थिंक हो सकते हैं, लेकिन तुम्हें अलग-अलग डायग्नोसिस बोलने पड़ेंगे। अभी मतलब तुम कह रही हो कि complicated withdrawal state है, तो what is the complication?
So psychosis.
हाँ?
So psychosis.
Psychosis का induced है ना, psychosis का induced state है ना, withdrawal state होता है।
Complicated नहीं होता.
withdrawal state कितना टाइम रहेगी? 5 दिन रहेगी, 7 दिन रहेगी।
तो सर withdrawal state uncomplicated बोलेंगे सर.
नहीं,
So withdrawal state नहीं बोलेंगे.
ठीक है, there is no clear evidence of clear documentation and evidence of cannabis withdrawal state causing a condition of psychosis. I don't remember any of the literature. लेकिन अगर इसमें cannabis withdrawal state ठीक है, you don't mind because you get yourself in trouble without it. See, delirium is also psychotic state, but that is a different. We must have the ability to differentiate delirium from a psychotic state, but we go psychotic state. Okay, now how to differentiate it? So if it arises, then we have to see whether it is a withdrawal condition or something else. Okay, as I said, we don't know the kind of delirium, but as per your symptom presentation, it's in the case of psychosis. And anyway, last intake of
The last intake was around so yesterday.
last intake was yesterday. Symptoms कब से थे?
So since last 20 days.
उससे withdrawal आएगा। withdrawal तो आज शुरू होगा, अगर आज को withdrawal symptom आएगा उसका, psychosis and withdrawal can मतलब theoretically can be present, ठीक है, we cannot say कि theoretically cannot be present, theoretically can be present, alcohol-induced psychosis और alcohol prevalence दोनों मिल सकते हैं, so theoretically they can be present, and if they are present, I think कोई case vertically of course लिखा हुआ है कि जितने mention कर सकते हैं vertically but I don't know but in this case this has to be I don't see any mention of any withdrawal cannabis withdrawal presentation so वो अलग टाइप का yeah actually 11th का participation बहुत है ना आप लोगों का बनाना का प्लान चलो ना सब प्लान कर मैं देखूंगा बताओ पायलट लेवल में क्या है क्या है मैं आपको बाइपोलर क्या है
So, so in points of favor, cannabis is like he's taking cannabis since last 5 years. He was abstinent in between, but since last 1 month, there was still intake in cannabis, and after that only the complaint started since last 20 days. So although he was, yes, sir,
the moral is restart cannabis restart okay
so in previous episodes also he was taking cannabis. So past history, so 1 year.
the moral relationship cannabis intake and psychology
So the symptoms, so there were no symptoms in between when the patient was not taking the substance. So in bipolar, so bipolar points in favor are like 1 year back, there was the current episode is the mania because there was a history of over talkativeness, decreased need for sleep, increased self-esteem, and so irritable behavior, so increased psychomotor activity, so increased flow of thoughts, decreased need for sleep, and so increased self-esteem and grandiose thoughts. The points against bipolar disorder are like there's a intake of substance, so the condition can be explained by substance also. So,
presence of mixed picture is actually more than because again bipolar is the presence of mixed picture of symptoms. A lot of thyroid symptoms were there, a lot of throat symptoms were there, like action these symptoms go yesterday. Symptoms clearly
yes, sir. Yes. So depressive episode last time there was, so 1 year back. So there was some, the picture was so mixed. He was irritable at times. There was low mood at times. He stopped going out. He stopped talking to people. He stopped having meals with family. But he was irritable at the same time. Yes, sir. He was paranoid. Yes. But so the mood came first. After that, the paranoia started. The last episode. So he stopped going out, stopped talking to people. and irritability.
Mood came first when something else today is sad, it doesn't like what the others. Past.
So he stopped taking online classes also. Otherwise,
उसके बाद से और increase confidence, those ideas. Just हम लोग 5 सीजन तैयार किए थे ये कांटेक्ट presentation only after
are there any questions online? So there's no participant. Thank you.